Good afternoon, I'm Insomniac and welcome to my channel. It's Wednesday the 15th of June, 2:30 in the afternoon. So, in my previous video, one of the previous videos, I was talking about like that my energy had like totally dipped and it felt like I had like a body flu type thing, but nothing was actually wrong. Like just felt like really, really tired and muscle aches and all stuff like that. I was like that for well over a week, and that's why I didn't put a video up last week, so I do apologise for that. But since I've got over that, Jesus, my mood has been like really, really bad. Like it's been like really high, not like continuously euphoric high. It's been like euphoria mixed with dysphoria, but it's actually more dysphoric mania than anything else at the moment. So it's a bit like so you've got like the agitation, it's like a really, really agitated, irritable, angsty sort of I'll tell you what, if you've ever heard of Limp Bizkit's song Break Stuff, basically the way he's in that song is pretty much how you feel. That's the perfect song to describe and get that in you, like how it feels to be me at the moment. Like it's like a pent up aggressive, sort of like irritable, like everything's like just like bugging the hell out of me. And the thing is, the most irritating thing actually throughout the whole of it is actually myself. I'm irritated by myself because this time around I've got so much more awareness, and I can see when I'm being too talkative, I can see when I'm being this way, and I'm completely aware of what is going on. And that insight, although it's a good thing, as in it will help me recognise that I'm not well and get the help that I need, it's equally like I must really be like stressing out my family, like as in like my partner and like my sister and my dad, people like that, because like I can't shut up. Like my brain and my mouth are like, it's almost like if you've ever seen anybody on a coke high, but now you know with a coke high people could be like all happy and like, yeah, world's great, talkative, really nice, and all positive. That's what like euphoric mania is like, but dysphoric mania, and you actually do get it, I think, a little bit with cocaine as well. You can have like a dysphoric version of it where you're like easily angered, irritable, tetchy. It's just not a nice way to feel. It really is not a nice way to feel, and it's so unlike me because I'm normally so easygoing. Just to like get really wound up about the smallest thing, I hate it. I absolutely hate it because it's not a part of my personality. It really isn't, and I don't like it. And it's alien to me because the only time I have it is with mania. It's not a part of my personality at all. So what I've done, Jesus, I'm so sorry. I've like literally just like come in, introduced myself on this, and I'm just like, I'm so sorry. So we'll get off that bit for a minute. Health-wise, as in like physical health-wise, I don't know if I told you, I did get some more bloods done. Yeah, that's it. I'd asked for my folic acid to be retested, and I asked for them to do an active B12 array. So instead of just showing, like the things in the B12, like all of it as a whole, which is what they normally do, like a complete B12, which is what their doctors normally do. If you do an active B12, it shows how, it shows sort of like how much is actively working in your system. Because what's the point of knowing, oh, you've got this amount, but like 80% of it's inactive. So therefore, then if you've only got the complete one, it looks like actually, yeah, you've got an okay B12 level. It's like, yeah, well, 80% of it's inactive, so actually it isn't working all that great. So I did ask for that to be done, and when I had my injection yesterday, they said, oh yeah, we've got your blood test. We've got your blood test, so we've got your blood test results back. I'm so sorry, my mouth is like, we've got your blood test results back. and the B12 is fine, and your folate is really low again. It's like at 4 when it should be, I think, 4.8. So the low end of well, it's still low. It's still lower than it should be. Like, it's not in the normal range, but it's not a huge amount like below normal range, but it's still more than borderline, if you know what I mean. So yeah. So I said to her, I said, well, the thing is, I said, so it's low again? She went, yeah. I said, well, when I was on sodium valproate like 2 years ago, and I was on that for quite a while, like years, 6 years actually, but when I was on that, sorry, hair, when I was, sorry, so when I was on that, I know that does actually deplete folate. That's why you do have to actually be on folic acid tablets when you're on that, because it naturally depletes, not naturally depletes it, but the medication depletes it. But I've not been on that for years. And so when she said, yeah, it's low again, I was like, well, I'm not being funny, but it's like the 4th or 5th time in 3 years that I'm having to have gone on folic acid tablets. Like, that's not normal. Like, why would this be happening? Because all of the medications that I'm on don't cause a low folate level. None of them do. So she seemed to think that maybe, that maybe folate low, that something in my body might be working in a way that's stopping me from absorbing the folic acid properly. So I said to her, I said, well, have you any clue, like, sort of like, what would cause that? Because she was asking what my diet was. I was like, well, actually my diet's okay. Like, I know my diet's not healthy. I do eat a lot of junk and stuff, but I do eat vegetables, I do eat meat, I do eat dairy, and like all that sort of stuff. And like she was saying, like spinach, greens, like, yeah. So she thinks it's something about my body's unable to absorb it for some reason. And I asked if she, had any ideas of what could cause that. And she said she's not entirely sure and she wouldn't want to misinform me. So I thought, well, fair enough. Like, that's actually good. But I do think that thing that I was looking up, what's it called? Pernicious, a P ending in us. That sounds terrible. Something-ness, ferocious. I can't think of the blooming word. A form of anemia to do with B12, basically. That, if you've got that can sometimes, I think, affect the way your body absorbs folate. That and something else, another vitamin C. I don't know. But anyway, so she says she's going to write to my GP, and the GP will. The GP should be in contact about putting me on more folic acid again. But I think she said something about that she'll write to the GP, let them know that she thinks that it might be worth investigating, because I have been on it X amount of times. So yeah. Oh Jesus, my head, it's like so many thoughts and I can't concentrate, and it's like it's horrible. It really is horrible, because your brain won't shut up, it won't give you a rest, it won't stop. It's like having somebody as high as a kite, like being around someone like that, and it's like, oh, for God's sake, we just shut up, just sit down, just please, just give me 5 minutes break. It's like, so I'm going through that with me, as in I'm both. I'm the one that's being that way, but also, like, as in, like, the high energy and the blah, 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 and all that, and the this, there, here, there. But I'm also the one, please slow down, shut up, leave me alone, about myself, because I've got this awareness, this insight to it all, it is actually really annoying. It really is, because I'm getting annoyed just with myself. Like every day I'm just stressing myself out over, because I can actually see how it's looking to everybody else and how irritating I'm actually being. Like, I don't know. It's the negative emotions with it though that I'm actually really, really struggling with. Like, because I'm not an angry person. Yeah, I can be a bit irritable in the morning, can't we all? But like, that's not a part of me, so I really struggle with that. I don't know if people who are naturally that way still struggle with it. I haven't a clue. But what I've done is, she said that stop from beginning. My psychiatrist had said to come off of the trazodone, give it a couple of weeks, and then like see how I am. Well, obviously I'm actually getting worse. So that proves what I already knew, that it wasn't medication-induced mania. I knew that anyway. But obviously you have to prove to people, you know, that, well, they've got to do it in steps, don't they? Like, well, yeah, that can cause mania, so if we get you off that first and then see where we are, like that type of thing. And he said, you know, once you're off of it and everything, if there's no improvement, contact me, like contact the place, and they'll book an appointment. So at my appointment, I was like, you know, yeah, it's actually getting worse. Like, everybody's noticing it now. Like, I can't hide it very well anymore. And I can feel myself getting worse. So she was like trying to get me to describe it, and it was just, as I said to you guys, like sort of the dysphoric mania. She said, well, is it dysphoric mania and euphoric mania, or are you still rapid cycling? I was like, to be honest, I don't even know now. Like, I really, really don't know. Like, I have dips in the day of energy, and when I've got more energy, like when I'm like, I can see, I can see I look like I've got a lot of energy. I am exhausted. I am physically, emotionally exhausted. My mouth has all the energy. I don't. And this is the thing, it's like my mouth has all the energy. My body is doing things. Like, it's like, oh, it's going here, it's going there, it's doing this, it's doing that. And I'm just like a passenger on it all, like thinking, please stop, hold, I need rest. Just stop for a minute. And my body and my brain don't listen, and they just carry on regardless. Like, they're just leaving me like, it's really weird to explain, like, but that's the thing, like, it's difficult anyway, because I don't know if I've said before, but I was originally diagnosed with borderline personality, but that was literally based upon one appointment with a psychiatrist, like one analysis, and then they shoved me on medication for years. That was it. And basically, because I had a little bit of a rough childhood, they were like, oh yeah, tick the box for borderline. That's basically it. And it wasn't until I was hospitalised one time that they were like, oh yeah, actually no, it is definitely bipolar. Not bipolar and borderline, bipolar alone. Like, well, with PTSD, but no borderline. And then when I was hospitalised in 2015, so that's the longest I've ever been hospitalised for, like basically like 6 months, 5-6 months. First of all, when I was brought in, I don't know if I told you, but they actually thought that I was high. They thought that I was on drugs, having some kind of psychosis, drug-induced, like I'm on about illegal drugs-induced psychosis. That's what they thought. They're taking all lots of blood, and where I was like, as I am actually now, a little bit like the angsty sort of like irritable and thing. I was like, they're like trying to take my blood and everything. I was like, when you get those results back and you see that I haven't taken drugs, because at first I was like, you know, they were like, have you taken drugs? I was like, drug? Of course I'm not taking any effing drugs, you know. Of course I haven't. I don't do drugs. I'm not like that. I don't touch that stuff. And they were like, yeah, well, you do seem a bit. I was like, fine. You take my blood and I will prove to you that I haven't taken anything. And when we get those results back, I want a written apology. I want your job on the line. Like, seriously, it's really unlike me. I was like that. It was absolutely terrible. I was very, very ill at the time. Very ill. And I remember little bits from then. But a whole load I don't actually remember. But I've got off the point. Oh, yeah, no, that's it. So, when they realised there were no drugs in my system, they then thought that I had schizoaffective disorder. Now, bear in mind, they've been watching me for weeks and weeks and months, and they came to the conclusion that they thought that I had schizoaffective disorder. But Then they were sort of like, we can't tell basically if you've got a schizoaffective disorder or bipolar affective disorder type 1 with psychotic features. They ended up leaving it up in the air for a little while, and then eventually settled on the bipolar 1 diagnosis with psychotic features. That's what we stayed at, with the obviously PTSD as well. But it's really difficult. To be honest, it doesn't matter. It doesn't matter. Like, at first when they said schizoaffective, I was like, no, I don't mean disrespect to anybody, but I was like really offended. Really offended. 'Cause it's like, I'm not schizophrenic. Like, there's no way. Most of mine's mood based. I definitely don't have that. Definitely don't have that. I would not hear of it. But the weird thing is, like, my mum and my dad have bipolar. My dad, like I said before, he just has like sort of like the best type possible. Like, he's just always like a bit hypermanic, always happy, always cheerful, you know, like in a good mood all the time. It's like a toned down hypermania, and he functions very well with it. You know, it doesn't actually interfere negatively, it doesn't impact him negatively at all, and he never gets depression. It's like everybody would want that in a box. He's basically a walking happy pill, bless him. He really is. Like, and then my mum, she had bipolar 2. Well, she has bipolar 1, but she was being treated for bipolar 2 because she'd only ever had full-blown mania with psychosis once. And then never again. Then after that, it was like basically bipolar 2, and no more psychotic features after that either. But she did sometimes have sort of like delusional things, like paranoias, a few paranoias, but like no like sort of like hallucinating or anything like that. But she did the very first time, like years ago before I was born. And then my brother, he actually has a diagnosis of schizophrenia. So I see a lot of similarities, but my mum also had borderline personality disorder. Now that's the side of my mum that I struggled to get on with. Like, I did struggle a bit with that. But the thing is, like, my mum's actual bipolar, like that part of her, and my brother's schizophrenia. Well, my mum and my brother, I'm a bit like both. Like, you can definitely tell we're related. But when my mania progresses to the dysphoric mania, see, I'm all right. I've calmed down a little bit now because I'm talking and focusing on something and honing it in on something. So that keeps me calmer. So what am I doing? Right. So yeah, so my brother has schizophrenia. My brother and I were so alike, like personality-wise. Even when we get ill. Like, we have some of the same delusions and things like that. Like, we're very, very bloody similar. We really are. Like, my mum used to say, you know, you're like twins. You really are. You can't tell you two apart. And we are very similar. But that's the thing. If I were to have, if they were wrong and I actually did have schizoaffective disorder, I wouldn't actually be surprised, because I did look it up afterwards, like after initially being sort of like really insulted. And I looked it up, I was like, actually, you know what? I can see exactly where they're coming from and why they struggled, like between the two diagnoses. I can actually see that. And then also when I get ill, I actually am more like my brother than my mother with it, a lot more. But then saying that, mum is sort of more bipolar 2. Now, if she were bipolar type 1, and I witnessed a lot of that, then maybe, I guess I've never seen anybody like bipolar 1 and like got to know them for years and years and years and years and years and seen the ups and the downs and sort of like all that stuff. So, but like when we're ill, when my mum's ill, when my brother's ill, I can see aspects of myself, like my mum, in it, but I can see a lot more of my brother in it. So I think, but it doesn't matter, because like the treatment plan for The treatment plan for schizoaffective disorder and the treatment plan for bipolar are exactly the same, like exactly. So, I mean, what's the label? I mean, does it really matter if the treatment's the same? Like, if you treat it the same way, like, does it really matter if it is misdiagnosed? Like, it doesn't really matter to me. Like, but yeah, oh no, I've gone slightly over. Shoot, yeah, there was so much I wanted to say. I've got this again. I've been doing this again. Where is it, sir? I've been writing down, I'm just going to quickly say this. I've been writing down a few things so that when my appointment with a psychiatrist comes up, I don't actually forget anything important, because this thing I always do. And then it's like, I should have mentioned this, I should have mentioned that, you know. He would have known how much help I need if, because the thing is, when I see them in person, it's like there's a part of me, and not actively, I will add, not actively, because I want help, I want to get better, I don't want to get ill, I don't want to get more sick, I don't want to get psychotic, I don't want that. But there's a part of me that tries to tone it down in front of people, you know, make me not appear as sick. It's like, it's almost like it wants to keep the mania because it likes the something friggin' my precious it likes the mania. It enjoys the good aspects of it, and it doesn't want me to get help, so it will deliberately mess me up, and it will make me sort of appear like I'm calmer. Like it takes over. It kind of takes over. So like when I'm like all like that, then it kind of takes over, and it's like, right, it calms me down, I don't appear as agitated, and like all this, and it's like it's messing me up, a nice way of putting it. It's keeping me ill. And every time I have the telephone consultations with the psychiatrist, it's like that bit takes over, and then I tell him things that I'm struggling with and how I'm feeling and stuff, but then there's this bit that keeps me calm and organized and coherent, and so I sound absolutely fine, nothing wrong with her. Oh, yeah, she was voicing these concerns. You know, she sounded fine. She spoke well, good mannered, and this, and it does that, and it's like you feel like kicking yourself. It's like, why do this? Why do this? So what I've done is, when I get a psychiatric appointment, I've actually asked. I've been like, no, I'm not having it on the phone. I want the appointment in person. I was like, because it seems that when I'm on the phone, I can kind of disguise, even though I'm not trying to. It's like a part of me is doing it. I'm not. It is. And it's like, what was I saying? Oh yeah. And it's like, it wants to keep me unwell, and I want to get well. And I think if I see him in person, I can show him all these bloody lists that I've been making and stuff like that, showing about the hyper focus. He'll see me, he'll see that I get agitated at this point or this at that point. It's more real. He can get a clearer picture of me in person, rather than on the phone, because on the phone I'm messing myself up, and I want to be put on the mood stabilizer. I want help. I don't want to be sick. I want a more even mood. I know it's never going to be 100%. It never will. It never is. But I want it to be, I want to be me. Like, but the annoying thing about it is like people, like, I saw my sister and she was like, oh, I really miss, like, I miss us having this time together. I miss us being like this. You know, you've got a lot of energy. You're really, like, talkative, and, you know, it's lovely. It's like you being back to the old you. And, like, I felt a little bit hurt, because it's like, and I said to her, I said, you do realise that's the mania that you're liking. That's not me. Like, it's not me. It's not part of my personality. I'm not, like, an outgoing extrovert. And the mania makes me appear more extrovert. Well, it is more extroverted, actually. I'm kind of like between normal and slightly introverted. And she's like, oh, it's lovely, you know, blah, blah, blah. And she went, and I mentioned, you know, it is actually the mania that's doing this, you know. And she was like, oh, stay manic for me, please. Like, people don't realise what they're asking when they ask that. Don't people think that I would love to be like the good parts of mania, so like having more confidence, being more talkative, being better around people, less anxiety, more of a life and soul of the party. You can joke around, you know, you've got good banter, you're brilliant with people. I mean, don't people think that that's what I'd want for myself? Like, that I'd enjoy being that way, because I would, the good aspects. But the dangerous thing with bipolar, it can be like a drug. People chase the highs, knowing, they still know, and they still do it. It's like a drug. And I was on that train for a long while. And it's like, you wait for these highs, and you ride them. But the thing is, at first it's good, it's so nice, and then you end up destroying yourself, you end up destroying things around you, you become destructive, you become not a very nice person, in fact a complete swear word, yeah, but you can become a really nasty piece of work. And then after all of that is over and done with, that whole episode, you've hurt so many people. There's things you can never come back from. And that's why I can't, you know, enjoy riding the storm. I don't know. The minute the storm started happening, the mania, I told my team, I told them, like, look, this is happening, that's happening. I've been honest from the start. When I get my depot jabs, they're asking, I'm telling them. And I've been honest the whole way through like that. But the thing is, when I speak to the psychiatrist, like I said, there's that part. And that part takes over, and it's not, I don't want it to, and it does, and it's really difficult to explain. In fact, I actually wrote it down a little bit, but then I realised it sounded bloody completely like I'm a schizophrenic. Seriously, listen to the way I worded this. Okay. So, this is one bit this is another thing I've been doing, but this will, like, put it in perspective for you. So, I wrote, I'm seeing my brother in me, as in the agitated hyperactivity mania thing, which we've discussed a minute ago. I've also been saying we, for example, yeah, so like I talk aloud, and I've been talking aloud a lot more, thinking aloud, I'm not sure which it is, but actually having a conversation with myself with it this time. So it's like saying we instead of me. So like I'll be like saying, yeah, it'll be good if we do that, I'll remember that bit. And like, I'm doing this to myself, like just me around, nobody else. It's really weird. It's like I'm having a conversation with myself. And then I wrote, it's almost like talking to the bipolar. Actually, yeah, it is actually. It's like I'm addressing the bipolar in me and saying things. It's almost like, yeah, it'll be good if we do that. And then, I'll remember that bit, like me, or I'll remember that particular part. And then it's like I wrote, it's almost like talking to the bipolar. I want help, but the illness tries to stop it, but I don't want it to. Wait, what? Yeah, the illness tries to stop it, but I don't want it to. As in, like, I don't want the illness to stop me from, I don't want it keeping me unwell. Like my bipolar subconscious is trying to mess me up and keep me manic. That's exactly it. And then I wrote, I'm acutely aware that it makes me sound schizophrenic. This is all stuff I'm going to be saying to the psychiatrist. And I've also mentioned my appetite splitting from comfort eating to eating like barely a thing, like maybe like one sausage a day or something, you know. And then when I become, how does that say, something, aware of agitation, I actively try to appear calmer and basically cover it up so that others won't see. That's it. And now that is the kind of behaviour I see in my brother. So like, say if he he'll be comfortable, and then like some weird things he'll be saying, and then you pick up on it, and then you're like, no, and then you're like, you know, remember you were saying that sort of stuff before when you weren't well, and then he kind of like backtracks, and then acts like that didn't happen, and he's back to normal again. Now, that is exactly what's happening with me with a psychiatrist. That's exactly what is happening. And like I said, he has schizophrenia, and I can see the similarities there. I can. Yeah, right. So now I'm really sorry. I've actually been on for half an hour. I do try to keep my videos to 20 minutes. So I'm sorry that I've gone over a bit. There's just so much that I haven't gone through. I will be back next week, next Wednesday. If I end up getting a bit sort of like I might appear before then. I might appear on Saturday instead. I'm not making any promises because my energy might dip. If my energy dips, I will not be around on Saturday. Saturday there might be a bonus. Well, not bonus, but you know what I mean. Like, I might just come on for like another 20 minutes and go through all of this that I was meant to go through with you today. Yeah, I might end up doing that Saturday if I end up having loads more to say and end up start scribbling down, then I might appear on Saturday as well as the next Wednesday. So, but if not, as it stands, Wednesday I will be here. Saturday I may make an appearance. We'll keep it that way. That's actually better. Okay, so if you like my crazy brain and you want to get more videos, see more videos or see the videos that I put up, then if you like, comment, subscribe, hit the notification bell, that would be great. If you have any thoughts or opinions or suggestions or I don't know anything, just put them down in the comments below. I do try to reply to all of the comments. Obviously there are times with bipolar that you kind of have like zero energy, and just like complete disinterest. So I mean, obviously if it's a day like that, not a good day for me, then obviously I may not be able to reply quickly, but I will get around to messages eventually. I will. So again, thank you very much, and I appreciate you taking the time out of your day to watch this video and spend some time listening to my craziness. Take care, and I will see you on Wednesday. Over and out. Bye.